H, how are you?
I'm well. Welcome to another episode of the Rogue Treatment Podcast. How are you, James?
I'm good. You?
That's good. Yeah, I'm well.
I am so looking forward to this one.
This is going to be a cracker. We've been looking forward to this for weeks now.
Yes.
After a really good pod with Lou, she pulled out a question topic out of the hat.
Yep.
And I think we've got no better person really to talk about this. But the question was from Bill from Bondi.
Mm-hmm.
He said, I saw a sinus relief technique on Channel 7 Sunrise. Is that legit or a load of shit? And look, that was how it was written. Okay. So I hope this person doesn't get too offended, but I'm keen to talk about not only that, but go into a little bit more depth about other areas. This definitely touches on things that we do as well. So it's going to be interesting.
Yeah, 100%. I think that's what the exciting part is, yeah, we can talk about the sinus relief, but, obviously you'll introduce her in a second, but, when you have a look at some of the stuff on social media, it's not just about sinuses. She's obviously a physio and got some really cool ways of looking at the body. So I want to dive into that as well.
Absolutely. Have you ever done a sinus relief technique?
I haven't. So maybe we need to practice it.
Do you need it done?
Maybe
we'll get.
I don't know.
Maybe we'll get it done now. All right. So, the guest we've got on today has definitely, as you said, created a following. Being on Channel 7 Sunrise, I want to know how he can get on there. But anyways, but yeah, definitely created a big following. Been on Channel 7 Sunrise. Just hit a whopping 40,000 followers on Instagram.
Oh, nice.
Which is unreal. And but yes, like you said, definitely done her her background work with a degree in physiotherapy like us, but honors in exercise sports science, Bachelor of Commerce as well.
Oh, jeez.
I know.
I didn't see that.
Yeah, and then some work obviously in nutrition, wellness, and functional medicine. And she prides herself as a holistic therapist and taking sort of less conventional pathways, which is what we love to talk about. We welcome Emily Korn.
Hey. Welcome, Emily.
Hey, thanks for having me.
No, we're excited to have you on. Obviously, Harry just talked about 10 minutes about your rap, which is pretty cool. Yep. Anything you want to add to that? Did he miss out on anything?
That was perfect. I was like, oh, I forgot about those couple of things. It was a while
ago. The commerce one? I was like,
right?
I wasn't sure if that was true.
It was true. It is.
Wow.
Wait, so did you start in commerce and then get into health, or other way around?
I did the double sports science, exercise and sports science, commerce, sport management. Then I did my honors in sports science. Then I worked a little bit in professional football, like in AFL. And then I was like, oh, this isn't for me. So then I went and studied physio. And then I also was like, that's not so much for me either. And then hence how the holistic physiotherapist came about, because I essentially went and have studied so many different courses. And really, I read books and podcasts, and then I just pull it all together and in a way that makes sense and works, really, most importantly.
That's awesome. Could you, first of all, just take us on that little journey that you went from being as a physio? And I think there might be a little story there that your sort of personal and professional worlds collided, maybe?
Yeah, correct. Those are the words. So I hurt my back really badly. It was a disc injury, and I had sciatica down my leg. And for years, I couldn't get better. I mean, I made some progress, but it was very slow. And it was years I couldn't work. I could barely drive 5 minutes to home. And then I just decided with physio, I just tried so many different things. I'm a really good patient. And I thought there must be something more going on here. And then I think it was when social media started, and I remember following a couple of people and thinking, yeah, this makes sense. There's so much more to the body, the muscles and bones and tissues. And then I waited for Perry Nicholson, so the Stop Chasing Pain guy who I've done heaps of my courses with. He came to Australia And then when I did his course, because we did a lot of hands-on work, I had 2 weeks pain-free. So I'd been in pain for 2 years. And I'm talking really bad pain, like lying down on floors in restaurants and stuff like that.
Oh
It's
my
pretty
gosh.
bad. So that was a light bulb moment for me. And that's when everything changed for my healing journey and professionally, because I thought, holy moly, why don't they teach us this in physio? And I realized there was a whole group of people, chronic pain, or just people who have recurring injuries, where I personally don't think that physio, looking at the musculoskeletal system, is sufficient enough to get these people better properly and forever. So yeah,
You touched on something really interesting there, right? We're going to open the can of worms early, right?
There you go.
But obviously, I say that all the time. Is university doesn't prepare us for what we're about to see, especially in private practice. It maybe prepares us for the hospital system. I think it does that well.
Yeah.
I don't know. I didn't work in the hospital system much, so I couldn't really tell you. But it definitely doesn't prepare you for the private practice world, where when someone comes in with an injury, it could be multiple facets, and we get taught at uni to look at the area of pain, but the area of pain is never the cause of the problem. So can you maybe tell us your little view on that? Obviously that's where you've kind of, from your own experience, kind of realized that, but tell us what your thoughts are on that now that you're kind of looking at it from a holistic perspective.
As in, you want me to talk about the fact we don't get taught this at uni, or just my philosophy in general?
Your philosophy, but what we probably should be teaching at uni as well.
Oh, I think it's a really hard one, because how many more years do you want to study at university?
I don't think we need more study. I think we need to study better.
Look, I don't know. I'm not gonna get involved in that. I think it's a complete, no, seriously, because I think, that's the reason why I think, in terms of when you look at the medical system as a whole, there are doctors for, there's a gastroenterologist, there's a cardiologist, there's a neurologist, because the body is so goddamn complex. And there are so many parts, and there are so many aspects, and there are so many interconnections. I don't necessarily think it's physio's fault per se. I kind of like to think it more as physio was setting you up with maybe, I don't know, 10, 15, I don't know, making this up, 15% of what you need to know. Now, if you love what you do and you're passionate about it and you're curious, crazily like I am, then it's your responsibility to go out and learn more in the areas that you want. And there are plenty of courses that you can do that. So I don't know if it's a university thing. I just think people need to go out and do continued education, which we're supposed to as physios anyway. But I just think that for me, I've just decided to go off in a slightly different direction.
Can you maybe explain that to us a little bit, what that direction looks like?
Yeah. So the way I look at the body is that there's a hierarchy of body systems, and the body systems are in order of significance to the body in terms of survival. So if this system shuts down, how important is it? Am I going to die? How quickly am I going to die? And so for me, number one is the brain, spinal cord, the central nervous system, and then the lymphatic system, then circulatory system, so blood flow, then nerves. There's some gut there too. And then you've got the endocrine system, and then you got muscle and tissue, and then where the pain is. So as far as I'm concerned, the muscle, the tissue, the bone is often, unless it's a traumatic injury, something like that, that's obvious, that's where the pain is presenting, or it's ended up. It doesn't necessarily mean that's the source. And particularly with the patients that I deal with, who are chronic, who are complex, who've been to see every single other practitioner under the sun, and then think, what the hell, I may as well try this. So then at that point, when the pain has been going on for a long period of time, then there are definitely so many other systems and reasons as to why these people can't get better. And it makes sense, right? Because all of these systems and all of our body parts, they work together to enable us to function. So it only then makes sense that we should address healing, pain, and whatever it is really in the same way. And that's where I think that physiotherapy, I mean, obviously it works for some people, but just for the kinds of people that I see, it obviously hasn't, and it won't.
I just want to pull that back. I like that description there, but you said at the start of that it was important for people to go do their own research and go do their own way of method of treatment, especially post study. We are encouraged to do extracurricular courses and things like that. We've done a lot of that. We've done a lot of things that are a little bit alternative. I'm not going to sit here and say that we do the same philosophy that you do, but we do look at the body alternatively. And the number one thing that we've always been questioned is, well, where's the evidence for that by people in our own industry, right? Like, this isn't clients, this isn't people that we're helping and treating. They just want to see a result. They want to feel better, right? But the number one people that talk shit about us and put shit on us are the own people in our industry, because they'll come back to where's the evidence. So how have you dealt with that, and what's your thought on that?
Oh gosh, how much time do we have here? Okay.
We have time to sort this out. This is fucking important.
Number one is, I think there's a lot of people out there who, unfortunately, when there's a new idea or something that they don't know about that goes maybe against what they do, feel threatened. And then that's the first thing. It's like, where's the evidence? Where's the research? The thing is, I don't know about two of you, but I went to University of Sydney, and we did so much on ultrasound and interferential and all this other stuff, stretching even, and in particular with stretching and with the others, the research is inconclusive. Yeah. Like, there's heaps of research. It's inconclusive. It says, well, we can't be certain that it's going to help. In some cohorts it does, and we can't be certain that it's going to harm. So that debunks what they're saying in a way, because it's like, I don't know, that's one thing. Then I just don't think, like what you said, as long as you're getting your patients better, I don't think it's the be all and end all, whether it's research backed. The thing that people don't understand, and they say, I'm a witch, I'm a this, I'm a that, which is an absolute compliment, by the way, is that it's science. It is science. It is physiology. It is anatomy, and it's just different. And people, unfortunately, don't like that, and it's an ego thing. The other thing with research is that it takes like 40 to 50 years for things that we know maybe anecdotally to become research or published in the research. And the problem with most research is that if you want to create a really, really good, strong, robust study, you got to pay, I think it's like $100,000 or something like that. So a lot of these research studies, unfortunately, are kind of somewhat biased, because the people, not all, right? Because I'm going to be struck down for this. But there are some.
That's why we're here. Don't worry about
it. I know. You're like, this is what we want. But I think it costs a lot of money to make research, and I think some people probably wouldn't wouldn't pay that money if they weren't somewhat certain of an outcome. So I don't know. If you ask me, I just say to those people, so many people say, that's bullshit. That's this, that's that. Oh, well, don't use it. Don't worry about it then. People, it's an ego thing. I think people get threatened.
The ego.
The ego.
The research is definitely like you say, it's where we just sit on the fence. There's no one actually being accountable for like, okay, no, this is a direction, let's go down that direction. It's sort of like, it does work for this person or this type of cohort, like you say. And then what it's never actually getting to is the person, the actual unique characteristics of the person. And I think that's definitely what we've tried to do. And treating the person and looking after the person is number one, as opposed to the evidence. And we always sort of kept pushback on that, because it's like, oh well, you're doing this or that, but what's the evidence for for that. But at the end of the day, if it's getting the client to the outcome, and one of our sayings is that we don't sell physiotherapy, we sell outcomes.
Yeah.
And that's what we're trying to do, because each person is different. And I'm sure you'd find that with, all the different systems that, uniquely define us. But
Can I just say something on that, Harrison? You said something really interesting. There is a ton of research, and it was one thing that we did learn at university in physio, the social, what's that system?
Yeah. Biopsychosocial model.
Thank you. That essentially pain is an experience. It's multifaceted. It's multifactorial. So then it actually is research backed, exactly like what you said, Harris. And it's not, we treat the person, and that is what the research tells us to do, because we know that their environment, their social situation, their finances, their stress, that all contributes to their pain experience. So, and the other thing is that a lot of this stuff, if you look up lymphatics and pain, or if you look up nervous system dysregulation and pain or headaches, or there is research. It's just, I don't know, how much are we going to go on about research? You know what I mean? People
that's
ask
banned.
me,
That's
can
a
you send
banned
me a
word in our
paper?
clinics.
Yeah, I don't know.
Banned,
People say, can you send me a paper on it? I'm like, you look for it yourself, no offense. I'm sure there are. It's just probably not, they're not 100% testing this and that. But we do know that the facts are science. We do know that certain things cause problems in certain areas. It's just not widely recognized, that's all.
No, I agree, and I'm gonna push back on the biopsychosocial model a little bit, right? Not because I don't agree with it, and I don't agree with your analysis of it, but I feel like biopsychosocial model is used as a way for the industry and for physiotherapists to, instead of find a solution to the problem, it's a you problem, and if you don't listen to me, I can't help you, and it puts a bad name on the industry. That's where I have an issue with the biopsychosocial model. You talked about, obviously, having a look at the nervous system, lymphatic system, I think you then said the circulatory system and all the way down, right? If you're looking at those different hierarchical levels, they require a physical change to them to make a difference to that person. But where the biopsychosocial model gets used too much in our industry is we then become pseudo psychologists. And I don't think that that's what people want from a physiotherapist. They want someone to physically help them, whether that is with education. I'm not saying it can't be with education, but they want them to help with a physical change to something that's happening in their body, not to be talked about it like you're in a psychology session. That's where I think the biggest problem I have with the biopsychosocial model is, yes, stress has an impact. Yes, all those different issues have an impact on our body and our pain and all those kind of things, but not to the detriment of actually getting an outcome. And I think that's what's probably the biggest problem in our industry. I don't know if you've got any comment on that.
Not so. Not more than kind of what I said. I understand what you're saying. I guess it's not really something I've thought about, to be honest with you. But yeah, I think we're just. As physios, you're right. People want hands-on physical manipulation, physical therapy, and they don't expect anything else. But the thing is, they do need it. They do need it.
Oh yeah, they definitely need it, 100%.
And also physios, maybe we're not taught how to deal with those other components. So we're told that it exists, but then we don't have the tools. Which, by the way, there's plenty of other people that do. So, and often you need more than one practitioner for a chronic pain patient.
Yeah, and I guess that's why you've become so followed and so unique in the field, is because that we're not you know, we don't come out of university with these holistic views. We come out and go into one area, or even if we're going into like our sort of private practice field, we need to do months and months of training just to be prepared for their first sort of patient. But yeah, it's definitely, I mean, we could go into the sort of research and in terms of the what happens at university and what have you. But I think it'd be really cool to now dive into what sort of like to talk about with our viewers, what you do day to day in terms of you being so holistic. I mean, when a client comes to see you versus when they go and see maybe a more conventional physiotherapist, are you sort of seeing them after when they haven't got results, or are they reaching out to you first and foremost?
For the most part, I would say not the last resort, but they've tried everything else. And I quite love it. I love it that way, really, because the more complex, the more challenging, the better. So when someone comes to see me, I mean, there's a number of different processes before they enter the room, but the idea is that, like I was saying before, I'm looking at all of the different systems. So from what they're telling me, and then assessing with my hands, so palpating lymph nodes and the vagus nerve and organs and other nerves and tissue as well. And then making an assessment on that as to kind of what I think is most important. So I don't know. I know that's pretty broad, but I hope that makes
Can you maybe touch into that? You've said a couple of times, obviously the first one you look at is the nervous system. And obviously you said that hierarchy of needs of the body starts with the nervous system and the brain, right? So can you maybe give us a little insight into why that's the first place you look? And you obviously mentioned vagus nerve, and vagus nerve is huge on, you know, stress response, fight or flight, all those kind of things. How does that come into play in your assessment and then into your treatment of chronic pain as well?
Okay. So I was saying before about the nervous system, about the central nervous system, right? That the brain and the spinal cord, the brain is the most important thing to the body because, of course, it does so many different things, so many different important processes. The most threatening thing to the brain is stress, mental, physical, emotional, viral, infectious, etc. And the one thing that can save the brain is essentially the vagus nerve. So you touched on there, and what most people think is the vagus nerve assists with the stress response. So it shifts you out of fight, flight, freeze, freak out into more of a rest, digest, and heal mode. But the problem is that with most people who have been under long-term stress and many incidences of different big stresses in their life, the vagus nerve, unfortunately, it's probably, we're pretty faulty in this way, but it kind of goes offline. It doesn't function as well as what it should do. So not only is it important for the stress response, but it helps to dampen inflammation in the body. So that's super important when it comes to chronic pain. And then, of course, it has a lot of roles and functions in digestion and elimination. But so many people that I see their nervous system is dysregulated, essentially meaning that they're stuck in stress. They're not able to shift in and out of it. And part of that is to do with the vagus nerve. So for me, when someone is in that state, it's almost like they're running from a tiger 24/7. So when you're running from a tiger, your brain is worrying about, holy shit, I need to run and survive, and thinking about not dying. And so things like healing, digestion, elimination, etc., is really put on the back burner. So with people in chronic pain, it's crucial to be able to calm the nervous system and help to teach their nervous system to be more regulated. But also when it comes to stress, whether it's any stress, the brain, the body would much rather experience physical than emotional stress, right? So what happens is that the muscles and the tissues in the body tighten up, and the problem with that is you can appreciate, if you're stressed, like your first kind of response is that tenseness. I think everyone could recognize that. But over time, people kind of live there. The problem is that tight tissue or tense tissue doesn't accept fluid flow well. So if we kind of go back to my hierarchy, you can't get good lymph flow and you can't get good blood flow. So number 2 and 3 on the hierarchy system, plus you got number 1, 2, because the nervous system is not regulated. So that becomes a problem because then the muscle can't get enough oxygen. And we know that with any part of the body, if you can't get enough oxygen, then you start to experience pain, weakness, injury, stiffness, etc. So often, I would say very often with the people that I see, I don't even really need to do much to the muscles or to the joints, because once I work the nervous system, once I get much better lymph flow in and out, so the lymphatic system, for people who are listening and don't know what that is the system that gets rid of virus, bacteria, infection, inflammation, waste from the body. So if you've got an accumulation of that stuff anywhere, that's going to lead to inflammation. That's going to lead to anything, pain, stiffness, etc. But not only that, like if it's in the brain fog, I know you're going to ask me later about sinuses, but that it's all the same. Because for me, actually, when someone comes in, it's not so much about the symptom. It's more to do with, because people say, oh, I don't know if I should come to you. This might be really too complex. It's not about the way that the body's presenting or the symptom. It's about how are the systems operating and what is malfunctioning.
That's really interesting. Like I have a question around that. It'd be interesting to see what your thoughts are. So one system that we haven't touched on, and a lot of people will put this in the musculoskeletal system, but one area that kind of ties the vascular system, the nervous system, the guts, and then the musculoskeletal is the fascial system. And the fascial system gets like kind of just discredited because we don't really understand it. How does that come into your kind of hierarchy there? Because like from my aspect, I've found it easier to treat the fascial system than it is to treat the nervous system. And obviously I don't have the knowledge that you do on the nervous system, but I've found ways to calm the nervous system through that. Is that something you look at as well?
Yes, definitely. I guess, when people say, oh, what are you working or what are you trying to achieve? The thing is, if I put my hand there, some might say, oh, you're, working the collarbone. Some might say, oh, you're releasing the scalenes and the anterior neck muscles. Some might say, oh, there are lymph nodes here. You're doing lymphatic work. Some might say, there's arteries, veins, superficial nerves, brachial plexus. Do you know what I mean? So when you say I work the fascial system and I calm the nervous system, well, yeah, like guess you're doing both. And
I agree.
That's the beauty of that is the beauty of it. But yes, in terms of fascia, I wouldn't say I do a whole lot of fascial work per se. I do feel like it's down towards the bottom part of the hierarchy. When I say the hierarchy, it's like, because if your liver carks it, you're in deep trouble. So understanding that that's a much greater problem to the body than if there's fascial tension. Not to say that fascial tension is not important. It is.
No, I'm not talking about fascial tension.
Oh,
that's what I'm saying. Yeah.
What
So that's where we go, right? We go
Yeah.
with fascial tension being the musculoskeletal aspect
Yeah.
of it, right? From the stuff that I've looked at is that and this is why I always come back to, we don't properly understand the fascial system, right? But there's lots of research around the fascial system being the connector between all those. The connector between the musculoskeletal, connector between the nervous system, connector between the organs and the gut. And there's recent studies or recent evidence that shows that there's communication pathways within the fascia as well. That's the bit that I think we get stuck on, is that yes, I agree, fascial tension is not going to fix anything. Just because you release a little bit of fascial tension, it's not going to change the world. But what impact does that have on all those other systems that you're talking about. And I think that's why I asked, do you look at it as a connector? I think that's the part that I look at as a connector between all the systems. Yeah.
I misunderstood you, but I 100%
No,
agree
you're right.
with
You're
you.
right.
In terms of, I 100% agree with you in terms of its role is so important in like the connectivity of the entire body. I still don't think, just in my work, or maybe it's just that I haven't focused in on it as much as maybe what you have, that I don't do anything specifically for that. I mean, I do a bit of those anatomy trains, you know, the fascial slings and that kind of thing. I do the belly button stuff. I don't know if you've seen that on Instagram, but I'm very much into, so if we're talking about fascia, all of the fascia in the body, it starts and ends or is at the belly button. It's the fascial center point. So I do a lot of belly button work on people, and I guess is probably maybe what you'll be more so interested in with that question is looking at the belly button like a clock and then seeing at each time point, because often there are parts that are more tender and that are less tender. And for instance, if, there's like 2 o'clock and this is testing my clock and 7 o'clock, so the diagonal, that's tricky. If that, sometimes let's say you find that those two are the most painful, and then that person has left-sided shoulder pain or right-sided hip pain. So yes, in that case, I look at it, but I don't do a heap of fascial stuff other than that.
Cool.
Yeah.
That makes sense.
No, all good. I just wanted to see if there was some connector that you looked at there, because that's something that interests me, is that there's got to be something that connects all those systems. They can't, they kind of do connect in a way, but the nervous system and the way the brainstem works is in its own kind of way, right? And then, we can argue that then the lymphatic system is probably the connector between that and the blood, the circulatory system, right? But it's just then how does that all come together? And that's the area that I'm interested in. I don't know if it's fascia. Like I said, it's just something that I've been looking into because it seems to be the only connector in a physiological aspect. Obviously, how that then connects, we don't know yet, but that's where my interest goes. That's all.
I'd say the nervous system's the connector.
Okay. Explain.
100%.
That'd be awesome. I'd love to know that.
Like 100, if that is for me 110%, because nothing functions, nothing happens in the body without the nervous system sending the message via the frequency. Like the lymphatic system is directed by the nervous system.
Mm-hmm.
So all the other organs so every system really. So I actually think it's more to do with the nervous system. The nervous system is uber important. Is the connector.
Yeah. How do you then assess that as a connector, the nervous system? How do you assess that and then treat it if you find that that's been the main issue?
There's kind of two parts to this, but so a lot of my work, I've studied amenoneuropfrequency therapy. It's a therapy out of Spain. Last year I went to Marbella, no joke, to do another part of the course. So I've done like another 2 or 3 levels. And essentially it's frequency medicine. But the idea and the premise is that the nervous system is the commander of the body. Like I said, nothing happens without it. And when there's any inflammation in the body, then it travels via the nervous system, and then that's what then can create issues anywhere. So within that course, I have learned advanced palpation techniques that we weren't actually really taught uni, or at least I wasn't, how to palpate a nerve.
No way.
We were hardly taught how to palpate a muscle.
Yeah. So within that course, which is probably, it's been a huge part in the way that I think about the body and the interconnectedness. But I do a lot of nerve palpations, a lot. And that gives me a lot of information. But then that's, we can talk peripheral nerves, central nervous system. I can palpate the vagus nerve that runs through here. So, yeah, look, I think, you know what the thing is? I think there's no one way to skin a cat. And I think that depending on your area of interest, like you're obviously really interested in fascia, so you've kind of deep gone down that rabbit hole, certainly more than
No,
I
I'm
have. Or
interested in
you're
helping
not.
people.
Right. Yeah. Well, so am I. Hence why I've just gone into so many different areas, because what ends up happening is people come in and it gets, for me, it's more and more complex, and it's more and more long standing, which means more layers. And then I think, I really want to know more about that. And then I kind of go there. So
Yeah, which is exactly what we try and do as well, right? Is because, like you said, we weren't taught how to palpate nerves. We weren't taught how to do this stuff. It's up to us, right? It's up to us if we want to be good therapists, if we want to help people, to find the best way to do that. And that's literally what we've tried to do. Is, and part of the reason why it was really exciting to have you on is because, like, we want to see what else we can add to our method of treatment that can be a difference. And for me, like, I've gone down a few different pathways. At one point it was looking at gut health. At another point, it was looking at the way inflammation impacts the body, but I've never gone down the nervous system pathway. So I'm super keen to learn more about that. So when you're talking about obviously palpating nerves and things like that, you're obviously looking for something that's overexcited or overworking, similar to what you would do with the musculoskeletal system. What are you looking for there?
yeah, exactly like what you said. Yeah.
Okay.
That's exactly. Because then it depends. It really depends. I use a whole lot of different things, but if I am doing more of that ANF therapy, I use discs. So I use discs on the nerve to rehabilitate the nerve. Just a different way of thinking about it, I guess. But yeah, I do a lot of that kind of stuff.
Yeah, awesome. And going back to the vagus nerve, obviously there's so much talked about how the vagus nerve can impact not just stress, but obviously then the response that the body has. What's your kind of, if the vagus nerve is overstimulated, like we would talk about diaphragmatic breathing as a way to calm it down. Obviously there's other ways. What's your take on kind of addressing an overstimulated vagus nerve?
Do you mean understimulated? Because
Understimulated has a different. Yeah, no, you go. Either or.
you tell me.
Let's go both.
For the most part, most people are understimulated.
Mm-hmm.
Because the vagus nerve, the volume is turned down.
Yeah.
And we need to turn it up. But I think maybe it's just our different ways of kind of thinking about it. But because there's a very small percentage of people who are overstimulated, and then you've got to be really careful with vagus nerve, any kind of vagus nerve work. But a lot of my work, I did a lot of that, polyvagal theory, Stephen Porges, and he talks about the vagus nerve. And there's you think, vagus nerve, there are so many different parts to the vagus nerve, so many different branches. There's the ventral vagus nerve, there's the dorsal vagus nerve, which is below the diaphragm and into the stomach. So really depends on the person. However, if someone comes in to me, like pretty kind of common and stock standard, where they're under a lot of stress, they've got pain or whatever else they have, I'll always be trying to stimulate what's called the ventral vagus nerve, because that's the best way to shift someone quickly into a rest digest space. And that is to do with a lot of around the head, the neck, the face, and the jaw, because most of the way in which the body and the brain knows that it's safe is through the social engagement system, which is essentially made up of a number of cranial nerves, so cranial nerves in the brain, that have hearing or sight, or around the head, the neck, the face, the jaw. So the more information, the more stimulation of those nerves, the more the brain can feel safe, and the more vagus nerve stimulation.
Mm-hmm. Okay.
If we sort of take an example here just for our viewers. So let's just say that someone's got neck pain, right? And they're an office worker. They're a weekend warrior. Maybe they hit the gym with their gym community and go for a run on the weekend. And they come in and they're super stressed. They've got kids at home, working crazy hours, a lot going on, and like they're coming in, they're shrugging their shoulders, that classic sort of look, right? And they're sort of hunched over a little bit, and they're saying these things like, I'm under so much stress, I've got so much pain in my neck, I hold my stress in my shoulders, like we hear that a lot. I think we definitely try to look at where this sort of started in terms of the biomechanics as well, and like and fascia. Where did it start? Is it down lower, and the effect of the whole spine plays on the neck. And if we look more at the vagus nerve, is that where you're going to go first and foremost if this sort of client's presenting, or are you sort of, obviously we're saying that it's the vagus nerve is understimulated if we're in that sort of frightened state, right? And high stress.
Yep.
Yeah. So is that what you're going to go to first?
Because, and this might be confusing, I have the hierarchy, right? But like what I was saying before, I don't just be like, all right, I'm going to work on the vagus nerve and the nervous system, and I'm going to wait for that, and then I'm going to go to the next thing. Because essentially, probably most of what I do in the first session will be a combination of vagus lymph and blood.
Right.
And because, like I was saying to you, when I'm working the head, the neck, the face, the jaw, the lymphatic system, the vagus nerve that runs just right here where the collarbone is, where the main lymph, particularly on the left-hand side where the end point of all the lymph in the body is, I'm working it all, if that makes sense. So
yeah, touching on both sides. I get that.
So yeah, with that kind of person, and that's probably a typical person that I see. That's what I do. That's what I do. I usually do those couple things, because the thing that I find is that once you start to get those systems working, then often either the pain reduces, it completely resolves, or something else pops up, and then you can kind of hone in on that. And then I believe that, because I still give exercises, I do a lot of breathing work in certain positions with people, and a lot of diaphragmatic stuff. And I just believe that when those other systems are working optimally, let's say, then any exercise you're going to give them is going to work even better.
That's interesting, because we obviously say the same thing. Like, you don't want to load someone up if especially if any particular exercise could obviously exacerbate that same chronic problem, right? Like, you don't give someone who's got a shoulder injury shoulder exercises.
Oh, but the research will tell you that if if a muscle is not, if it's tight or whatever, then you just strengthen it.
Yeah, but we know that
it's madness. Hey?
We know that the research doesn't always work.
Yes, actually.
So I guess with the exercises, I'm not giving it because I think it's going to exacerbate them. I just choose to do other things that I think are more important first, for the most part. Obviously, everyone is so different. When someone comes to see me, they fill out a 7 to 8 page intake form of information before they even get to me. So that just tells you the amount of information and kind of different things that I ask people. So for me, that's pretty much kind of how I work and how I think. But obviously everyone's different. Like, you would find there's no recipe. If there was some magic bullet, then we'd be probably out of business.
Well, I say that all the time. There is no magic bullet, right? You got to find what works for people. And I think that's what is interesting about what you're doing, is that, there is a different way of looking at it, and it's going to work for a lot of people that conventional therapy hasn't. And conventional therapy, especially, just giving exercises because a muscle is weak, doesn't necessarily mean that you're fixing the overall cause of the problem. So, that I think is really important, that there is that conversation around other forms of looking at the body holistically. Obviously we touched on at the start how you came to think of that. At the moment, now that you're looking at all these different systems, and you obviously said in the first session you try and hit, the nervous, lymphatic, circulatory system from the start. When you've kind of found, maybe some setbacks, obviously you said majority of people that will help resolve the pain, but when you have found some setbacks, what do you then looking for after that?
What do you mean by a setback?
So you're training someone, and you might have tried a particular way of looking at it. Maybe it is you've gone further down the nervous system path, or maybe further down the lymphatic path, and maybe not getting the results you're looking for. How do you then kind of integrate all those other systems after that?
Oof. It depends on it depends on the person. In regards to setbacks, it's just a puzzle. It really is, because everyone is so different, and as good as we are with our hands and with our questioning and with our clinical reasoning and judgment, we don't have X-ray vision. So we can only kind of go off what we're doing. I think, though, a big part of my treatment is also lifestyle stuff, and diet and hydration is a huge one, and doing, stress management at home and whatever else, I give them, protein, whatever it is, it depends on the person. I always just say to people that I facilitate the healing. I kind of lead the body in the right direction. But then if they go home and just trash themselves or whatever else, it's kind of pretty hard. It's pushing shit uphill, if you know what I mean. Because a lot of people, I'm sure you find this in your practice, a lot of people want to come to you for an hour a week and they think, fix me.
Yeah.
I think, fix me. In saying that, I got to backtrack. Most people that come to me are absolutely ready, because they're so sick and fed up of being in pain that they're happy to listen. But when you talk about where do I navigate to, there's just so many areas in that, because it's why is their lymphatic system and why is the fluid not pumping well? It's not just about looking at the lymphatic system per se. It's like, what are the other pumps? There's the craniosacral pump. Is that if impacted? Are they breathing properly with their diaphragm? Are they hydrating? I mean, that's the number one, is the one thing I tell every single patient, no matter what, when they come to see me. Forget about it if you're not prepared to start drinking enough filtered and mineralized water a day. Forget it.
Oh, that's funny. I just told Harrison off about not having tap
gonna
water
get
in his
into that,
bottle as well. Well, we may as well. She just bought it up.
To be fair, you borrowed my water.
I did, because I ran out of water.
Too.
But can you go into that? Because I give him shit.
Oh, no.
I give him shit about that all the time. So, obviously hydration's huge. I think that's a massive part. I've looked into obviously different ways of, getting quality water in, whether that's, hydrogen charged water or, reverse osmosis filtered water, getting, electrolytes in the water. Though I hate drinking salted water, it's still good for you. Can you maybe give us some tips on what you're telling your clients? Because I agree,
terrible.
Hydration's massive when it comes to even if we were just to go back to the basics of the musculoskeletal system, the muscles aren't going to make a change, at all if they're tight, if they're not, hydrated properly, all those kind of things, let alone talking about the nervous system, the lymphatic system, or the circulatory system. They definitely can't work without, hydration. But yeah, what's your thoughts on that?
Correct. So I tell most of my patients, I tell all of them, they need to filter their water. Forget about it. You're wasting your time if you're drinking tap water. Let's see, Harrison.
I need another one.
You're just wasting your time. And I think a lot of people say, oh, it's What's wrong? You know, my father or my grandfather drank tap water. That's a whole nother story of, you know, how unfortunately over the years and the decades that our environment, our water, our air, our food is changing, and we need to adapt with that, because what's in our tap water today is probably not what it was. I don't know the stats, so don't ask me that. But what I do know today is that there are so many pesticides, chemicals, bacteria. They find antibiotics, they find birth control pill, they find parasites, they find a whole lot of stuff that if someone said to you, hey, try this, there's no way that you would. And
That's just
we
making
drink
my
it
immune
every
system
day.
stronger.
No, legitimately, I picked up his water bottle and I tasted it straight away, and I was like, "Nah,
You knew
man,
it
this is."
wasn't
No, I didn't know.
You know I don't drink unfiltered water.
You become a
Yeah, but-
Or
snob.
filtered water.
When
I've
you
become a
drink
snob.
water.
Yeah,
I'm
Legitimate
a
drinks
snob
out of
glass
because
bottles
it
too.
tastes different. It tastes
Yeah.
It's the filtered water tastes a lot kind of silkier and smoother. It's really obvious. Aside from that, I mean, when mainstream media start reporting about it, you know there's something to it, because recently they found carcinogens in our water, and that was reported in New South Wales and in Victoria. I don't know about the rest of Australia, but that I do know in these two states. And what they're saying is that the FDA in America, there was a certain level of safe of these forever chemicals, these carcinogens that we know stay in the body, and it's hard for us to excrete and make us sick. And in Australia, there were some places where it was hundreds and hundreds of times that limit. So I just say to people, if you're serious about your health, if you want to reduce inflammation, which is essentially the crux of anything, whether it's chronic pain, gut issues, I don't know, brain fog, etc., then if you're just drinking toxic cocktails all day, every day, what's the point? It's just you're just adding fuel to the fire. So, and also
Your body's
when
got to fight
you drink
against
tap
that.
water, pardon.
Your body's got to fight against that.
Correct. Well, you're just overloading the lymphatic system further, and those toxins then impact your or they kill, but they deplete your body's minerals as well. So then that produces an antioxidant, so it produces more inflammation in the body. So, and plus, drinking tap water just flushes the body. It doesn't actually hydrate it. So most people will look at me like I'm mad when I say you got to kind of double or triple your water intake. If you filter it and then put minerals back into it, you will probably go to the toilet less, if not maybe the same as what you were when you were drinking that amount, because now actually your cells in your body are absorbing and are being hydrated.
What about hydrogenated water? I don't know if like
I don't
you're
know so
seeing
much
a lot of
about
that.
it. I
Yeah.
gotta say. Do you?
No, I'm trying to do research, but everywhere that I look, it just keeps leading to like, companies that are probably just buying them bulk off China, right? So it kind of comes back to the whole that they're just jumping on the craze. So I haven't invested in it because I want to make sure that it is actually going to improve it. That's why I wanted to know if you had any thoughts on it. But yeah, it is something that I think, if there is, obviously the theory behind it is great, that, obviously increased hydrogen in the water is going to attach to oxygen and help oxygenate the systems within our body. But so the theory's there, but I don't know whether or not that's actually happening to the water that we're consuming just by putting it through this electrolysis, basically. So yeah, if you don't have anything to add there, then damn, I'll just keep researching.
No, not necessarily. The thing is though about that just because it's like food as well. Just because you're ingesting the right stuff doesn't mean that your body is able to maybe break down and utilize it. It doesn't necessarily mean that the oxygen is actually getting to where it needs to get to. And this is where there's like that holistic view. There has to be that holistic view on everything too. So I don't know. I don't know the research behind it. I don't know enough about it to comment, but
I think you guys are crazy. There's nothing wrong with me, is there?
There is plenty wrong.
Oh my gosh.
You
He
know
got me off
what?
the oats, I'll tell you that.
you know what? I'm happy to be called crazy.
Oh, that's fine. People call me crazy.
You're
but
When
But
I'm
not on
doing
the water part.
cartwheels when I'm 90, And
Fair play.
I don't want to wish badly on anyone. Each their own, honestly, but that is just a known thing. Just a known thing. If you want to,
Yeah.
I think that is one of the biggest foundations of health, and it's actually a very easy change to make. It's not that hard. I have a filtered.
Yeah, what are we doing here? We're
I,
just
I
buying
just
a
have
filtered
a filtered
thing.
jug. It's easy.
Oh, wait,
Filtered
I'm a
jug.
little
You
bit
got it
further
there?
down the rabbit hole there.
Yeah.
I've got like a reverse osmotic filter. So
Yeah.
like it's taking the shit out. I'm making sure
Can I
it
just
is.
say? Can I just
As
say?
in mine takes everything out. Have you got yours under your house though? It's all on
Oh
the
my
water.
god.
No, mine's like
wish.
Yeah, in his
Like a lamp.
doomsday.
no, I don't have that. But mine's just a machine that you got to
Locker.
put the tap water in. It
yeah.
filters through the machine, and then
Yeah.
it comes in a jug, and then I pour it from
What?
the
Where
jug.
does the waste go? The
So
filtered. Where's it filtering it out? Where's it go?
at first, I was getting fucking freaked out because we would. It says to tip the water out. Like once you've used the tank, it says tip it out, and I was tipping it out, and the water coming out was fucking yellow, and I was like, why is the water coming back out yellow? I didn't think that the waste was going back into the tank, and that's why you
Yeah.
gotta. Yeah,
So
it goes
the waste
back into
goes
the tank.
yellow.
Yeah. So all that shit that was taken out of the water was going into the tank and is yellow. And you would pour it out and what was left was yellow water.
All right.
I
So
believe.
I gotta
lots
see
of
that
waste.
first.
Yeah.
I got to see that first.
All right,
before
I'll
I
show you.
change.
Come over. I'll show you.
I do have to say that when we got here, he asked me for my water because he had a headache because he's been not drinking enough water or drinking the
I
wrong
drink
water.
plenty of water.
And then he used my tap water.
I used your tap water and I said straight away it tastes like shit.
All right. Guys, we have to do this. Let's do a few, let's play a few games. I want to see this sinus relief technique in action. And
Yeah.
there was something else that you wanted to do, JB, but we'll get to that in a second.
Okay. Well, you're directing
Oh no,
this?
I think it was just the vagus nerve tip that you had earlier that I'd love to recoup again. But can we go through this sinus relief technique for Bill from Bondi? He wants to see how it's done.
Can I just say something on that for a second?
On the water thing?
No,
No, the
we're
sinus.
over
Oh, the
that.
sinus?
We've moved
Catch
on.
up, H.
Yeah, we've
Sorry,
moved on.
okay, good.
Yeah,
Thank
catch up.
God.
No, with the sinus relief, that can actually improve pretty much any symptom that you have in the head, the neck, the face. So it could be like brain fog. It could give you more mental
Headaches,
clarity. It
James.
could it could improve your headaches. So it's not.
I've got one right now, so let's go.
It is, but the thing is, right, that it's. I mean, I had 2 minutes or whatever it was on Sunrise. I did explain before, which I think it got lost because then the sinus relief looked so ridiculous, and people sexualized it and thought it was hilarious, but whatever. That
Was?
Oh yeah. Anyway, go and look at the Sunrise. Go and look at the Sunrise reel that they posted of that. It got like 20 million views or something because people were saying some interesting things. But what I want to say is that
Wait, I'm
sinus
confused, but let's not go there.
Shut up,
Yeah,
Sorry, go.
don't worry. It's probably we're keeping it PG. So essentially, the sinus relief, it's called the tentorium cerebelli. It's within it's part of one of the layers of the brain. It sits kind of there. If you cut your head in half, it's on both sides. It is fascia, and it is also the diaphragm in the head. So diaphragm just means it regulates and changes pressure.
Mm-hmm.
So that fascia is in charge of regulating the pressure inside the head and the neck. So what runs through that part of the tentorium cerebelli and the dura, which is part of the brain layer that it's connected to, is a lot of lymph and is the dural sinuses. So that is essentially the blue blood that's draining from the brain. So if you can appreciate that you have a pressure control problem inside the head, then you have poor fluid flow to and from the head, and then that can cause any issue. the thing about this tentorium cerebelli, maybe I should like demonstrate it before I kind of go on. But what really needs to happen first is a kind of a lymphatic release or reset, because everything that comes from the head and the neck has to drain down. And if you're blocked in the collarbone or anywhere in terms of the lymphatic system, then you're not going to be able to drain anything. So it's just going to get blocked.
Okay.
And a lot of the time, and not all the time, by the way, because people say, that's bullshit, that doesn't work. Okay, well, maybe that's just not your problem. Number one, maybe it's not your problem. Number two, when I do that to patients, or when I do any of my techniques, because I know on Instagram, it's like a 5-second reel or whatever, but when I treat patients, it's a combination of all of it.
Yeah, of course.
And in a certain order. So anyway, well, let me just show you. Let's get back to the question. But like essentially, you put your finger inside, you probably wash your hands. That's the other thing. Their hands are dirty. Put your finger inside your mouth, and right kind of to the side, whichever side you want to go, but to the ridge, you'll feel a ridge at the top of your mouth. You press your finger up gently towards your cheekbone, like gently. You're not supposed to be pressing too hard. And then you get your hand and your thumb and you place it inside the ear and you pull the ear away, and you hold that there. So your hand comes behind your head. So you're actually pulling the ear away from the face, and you'll feel a stretch between these 2 points. So the reason why it works is not necessarily only because it drains the sinuses, but appreciate that the sinuses do drain or are here, but the dural sinuses and the lymphatics drain here. So by creating, and you have lymph nodes here, 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 here. So by creating that space, then you're encouraging the drainage, and then it goes down.
So when I'm pressing up, so obviously the palate at the top, where it's in the soft part?
It's in the soft palate right in front of the back of the teeth. So you're not on the teeth. And what you'll find is when you do this to a number of people, that a lot of people are quite puffy and swollen, and some people are more puffy and more swollen on one side to the other. And often you'll be able to know that because when you palpate the nasolabial lymph node before, or you can even just notice that some people are puffier on one side to the other. So the idea of that is, yes, it does help a lot of sinus issues because most people have a whole lot of crap, waste toxins, bacteria in their head that they can't get rid of, and it is presenting as sinus issues. But I use that for the majority of my patients with anything with issues here up, or actually anything at all, because in the end, the brain is what decides in terms of the output of pain or of anything. So if you don't have good pressure control inside the head and good lymph and blood flow and cerebrospinal fluid, and that's a whole nother thing, then anything's going to be impacted.
Okay, that's really interesting. My headache's gone.
My ear hurts.
You just
my ear's like...
No, legitimately, my headache's gone. But
that's because you had the
during that time that I could hear crackling as I was pulling. Is that right?
Correct.
Oh, okay, fuck. All right.
Like as in, when I say,
I thought I broke my ear.
Not everyone's going to feel that. Everyone will feel different things. For instance, a lot of people feel that kind of stretch, and some people actually feel straight away it opens. For people with sinus issues, that works pretty much straight away if it's going to work. If it doesn't, I don't often. I feel it's just obviously not their problem.
So, and how long were you holding that for? Is that just until like
1 minute? 1 minute on each side. Doesn't matter which side you go.
And then when you're prescribing this, say for someone like Buffhead over here, James over here, who's got a headache because he drinks too much filtered water, does he have to do that every day or like every time?
I don't really prescribe that to people because it's not. It's like saying it's like someone coming to you, and this is an example. Like you you release their upper traps. You don't then send them home with a massage technique that every day. It's often not necessary. Sometimes when they come back in, I'll do it again. But then it just depends. To be fair, I probably do that to most people because I'm, as I said to you, about pressure inside the brain. That
Yep.
dictates a lot of what happens throughout the whole body. So to
Awesome. I love
like
that.
that.
what was his name in Bondi?
Bill.
I used to live there.
Bill.
Oh, really?
So yeah, for a while. So yeah, to Bill in Bondi, just so he now understands the science behind it, and that's why it
Yeah.
works.
Awesome. Awesome. We spoke about an sorry to cut you off, but we spoke about an example with the sort of tight neck stressed person that comes into the clinic. Just a little strategy from your side for the vagus nerve in this situation. I think I've seen you do a sort of technique around the clavicle with some tape. Is there any sort of like tips or anything you can show us that we then obviously pass on to the viewers today?
Yeah. So tape is a great one. I don't have it handy, but essentially, the vagus nerve comes out of the brain through here. This is also a really important area because it's got the largest lymph node in there, and the neck sits here. Your main blood supply to and from the brain is here. You've got a lot of muscle, and a lot of people are tight and tense here. So that will impact lymph and blood and vagus nerve. So, and like, again, this depends on the patient, because sometimes what I do in like with my hands is enough for them. So it's patient dependent, but you can just use a bit of kinesio tape, like the stretchy tape, and just place it
Yeah, cool.
there on both sides. I do the collarbone one, but I wouldn't do both at the same time because that's like it's just too much. People think, it's tape. What could it possibly do? I had a couple of patients recently because it's very interesting. What I do is very gentle because people are so relaxed, and afterwards they almost look at me like, "Did you do anything? Oh, is that it?" And when I tell people you could detox, you could be on the toilet all night, you could I don't know, all kinds. You could have a really runny nose, you could get a cold, you could 9 times out of 10 people don't believe me, but the thing is that when you're working with these systems, it has an uber big or significant impact on the body. So in regards to the tape, like I wouldn't do everything at once. If you wanted to try that there, for 3, 4, 5 days, and then you can always add the collarbone too, because like here, this is also a really important area. So the vagus nerve comes down through here, the end points, all the lymph in the body ends up particularly on the left-hand side. A lot of blood flow, a lot of superficial nerves, brachial plexus is here. What else? The phrenic nerve, so innervates the diaphragm, runs down through here too. So the tape essentially just brings attention, the brain brings attention to those structures to stimulate it and helps to lift and decompress and reduce the tightness and tension, because then of course the tightness and tension is going to impact the function of the rest of those structures.
I just had one last question before we go into it. Like we always ask a sport question at the end, but one last question, just around this whole, looking at the body holistically, especially, you talked about your main practices around chronic conditions as well. It'd just be interesting to get your take on where these chronic conditions start. So, we've obviously talked a lot about today the fact that the nervous system obviously can be impacted, and then obviously the lymphatic and the circulatory system, all of that, right? But at that point, especially when you're seeing someone chronic, they're over, stimulated in those areas, and that's why they've got problems, right? And you're talking about how you can manipulate those systems, or try and clear the lymphatic system, or deregulate or upregulate the nervous system to try and get the body back into balance, right? When someone is first starting to maybe get acute injuries, or before it becomes chronic, how, in your experience, when you've seen these chronic injuries, have these injuries come about?
Probably the same way that the reason why they can't resolve. I mean, there's a lot of different things I could go to with this, but I guess if you think about, for instance, I'm just going to pluck something out of my head. So if you think of, someone who has recurrent hamstring injuries, hamstring tears and strains, and then you want to know, okay, so, they had one and then they kind of rehabbed it and then they pinged it again pretty quickly. Why is it now that they can't really get better? They can't get back to maximum speed. So this is just an example, but I hope this is what you're looking for. But then this is the way I always think about everything. All right, muscle. What does a muscle need? Or why would it not be able to be rehabilitated or working to full function? Okay, the nerve needs to go to that muscle to send an adequate and strong signal. Okay, so why wouldn't that nerve be sending the strong signal to the muscle? Maybe because the nerve needs glucose and oxygen to fire and wire. Okay, so why is it that it's not getting good blood flow? Well, maybe it's to do with the lymphatic system. And because if there's a whole lot of crap around the nerves, the cells, and the blood flow can't get in. So it kind of, I don't know if that's what you're asking me, but that is how, in what I see, an acute problem becomes a chronic problem, because essentially the body doesn't want to be in pain. The body doesn't want to be sick. And if given the right environment, it should be able to heal itself. Yeah. But unfortunately, for the most part, it's just not that case. I think maybe also what you're asking me is, why is it that the environment is that way? Maybe.
Well, maybe to help you with that, is the environment like that before the injury? The first time that they injured the hamstring, right? That then the hamstring can't heal properly, or does it become that way after the injury and then it becomes a chronic problem?
Both.
Both?
Could be one, could be the other, could be both.
Okay.
But yeah. And then obviously, with the hamstring, and again, this is not my area of expertise, sport stuff. Spectator, yes, but not as a physio. I've never really had too much experience. But obviously then, as a physio, load and that kind of thing is obviously really important. But unfortunately, the environment that we're in, just the environment that we live in, that our foods are no longer as nutrient dense, and unfortunately, Harrison block your ears, but our water is got a whole lot of rubbish in it, and our air. And this is just, unfortunately, it's just the way, we're spending more time inside. We're less outdoors. We're not getting as much sunlight. We're doing way too much screen time. We're not connecting with others as much because we're on our phones or we're watching Netflix or whatever we're doing. So I think, and that's why when I talk about holistic, it's not one, it's not the other. I always talk to people about a pie chart and everyone is going to have, something slightly different, but there's going to be a number of things that are contributing to their pain. And it's just a matter of finding out what exactly those points are. And sometimes it's a bit of a process of elimination, because you're like, okay, I thought that would work, but it didn't. Like, for instance, sometimes with lymphatics, or, there's depends on the patient, but sometimes people sit up and I think, that didn't really have the impact that I thought. But the reality is there are so many different layers of the lymphatic system. There are so many different things that impact the lymphatic system. There are so many layers of the nervous system. So it's just a matter of continuing through it. And then it just becomes, my clinical judgment and just experience. You just see kind of patterns, and intuition plays a huge role too.
Yeah, no, I like that, and thank you. I know that was a hard question to kind of like, because there's so many different, ways to look at it. But for me, I always say that there's no such thing as an acute injury. There's a chronic problem that has led to the acute episode, and that's why I thought I just wanted to get your opinion on that, right? Because if you're looking at the lymphatic, the nervous, and that kind of stuff, like, is there a breakdown in their functional system that then led to, or their functional interaction between them that led to the acute episode that then made it hard to recover, that led to a chronic problem? Or, because the way we look at it, we obviously look at movement patterns a lot. No one gets injured if they're moving correctly. So if you're moving correctly, then you're not going to find that problem. But then if you move correctly just once, you're not going to get injured. But you move incorrectly once, may not get injured. But you move incorrectly every time, an injury is coming, essentially. So that's why it was interesting to see what your thoughts are on that.
So, James, well, I agree with you wholeheartedly about your first point in regards to the fact that an acute injury often has chronic or other problems that lead to the acute injury. People come in and say, my foot is killing me today. I woke up with foot pain, but it wasn't sore yesterday. It's just that pain is almost the last way in which the last ditch effort sometimes for the body to tell you that there is a problem. And most of the time it's the one that people listen to because all of a sudden now they can't walk or they can't run so they're way more kind of jarred by that, other than, let's say, people who get tired or fatigued, or they're a bit moody, or they're maybe a bit forgetful. People say, oh, I'm just getting old, or, oh, I've got kids and I'm sleep deprived. And these are those signs and symptoms often that then come before the pain. Then the second bit you said about, well, if someone moves well, then they don't get injured. I think this is just my lens, why I just have a bit of a different take on that, because again, like my whole philosophy, there is so much more to what you physically do that contributes to pain. And I'd say 95% of the patients that I see, there is a huge emotional component to their pain. And that's another thing that I work with these people is identifying, acknowledging emotions, stored emotions, suppressed emotions, past traumas, because in the work that I do with the physical work, I do unleash or bring to the surface these kinds of things. Most people cry in the first session because there's just a lot more to it. But that's, I guess, the kinds of people that I see. And I also think you can move really well. But the thing is, if one of the other systems isn't working, then soon enough, you're going to be injured.
Yeah,
or
like that.
People who get stressed and have neck pain, it's got nothing to do with movement. But I know what you're saying. Maybe you're taking more of a sports kind of view to it.
I think we can definitely agree that there's, every injury is sort of multifactorial, aren't there? And I guess it comes down to the ability to actually identify a movement malfunction as well. And I guess your strengths are in the identifying of the systems that we've just spoken about. And I think being able to, we don't really see therapists that can identify at all. You know what I mean? And I guess that's definitely
that comes back to what we're talking about at the start.
Big issue.
That's what gives us a bad name in our place, right? Because people think that physiotherapists are just, you talked about machines when we were studying at uni. People still use that in our industry, and people do prescribe just exercises and don't, do any hands-on treatment or don't do any, in-depth analysis. And that's where, we really want to push the boundary on that. And we're not against any method of treatment, but it can't just be that. We want to have a better name for ourselves as an industry. Sure. That's what we're trying to do.
Not one fix for all, eh?
That's it.
Guys, let's get into the quick sports question.
Yeah.
If that's all right, Emily. So did you say you lived in Bondi, but now you're in Melbourne?
Bondi. Yeah.
Does that mean you're a Roosters fan, or are you a Melbourne Storm fan, or are you an AFL fan?
AFL.
Or neither? AFL.
Oh, jeez.
AFL, 100%. Yeah, I was born and bred in Melbourne, but I lived in North Bondi for nearly 5 years. There were some good times.
And who's your AFL team?
Melbourne. I was afraid you'd ask.
How are they going?
Sorry.
I don't even know.
Well, they had a few couple of good seasons.
Finished, but they're right at the bottom where they deserve. So, anyway.
I must say, in Melbourne, it's just a great sort of culture around the football teams. It's amazing.
They love it.
Very, very loyal. Even if
I
you're at the
think
bottom of
that
the table.
the difference is that, and I don't know, do you guys live in Bondi or like in the eastern suburbs, or where do you?
Inner West.
In the
By
West
the
area.
water? Do you live near the water? I don't know. I just found because the area that I lived in, people just have different priorities and they're just not brought up going to sporting events as much as what we are in Melbourne. It's very much, if there's sport on, it's on the TV, or like you're at the game, or it's just a different culture. And the weather's so much better when you go. The beaches. Yeah, I'd rather be on the beach, to be honest.
Fair enough.
Of course.
Fair enough. Well, thank you so much for your time, Emily. We've got one more thing we ask, like the topic for the next one.
As Bill put a topic in,
and Harry pulls it out of his
podcast.
shoe, which you probably can't see.
We've got a new one. This is for you, JB.
So the next topic that we're going through, it seems like there's no career progression as a private practice practitioner. Is this true? Ooh, well, that's what we're talking about in our next pod. But do you have any quick thoughts before we go?
On that?
Yeah.
I think that's a bit of a kind of scarcity, I don't know, maybe mindset, or just like a bit of a I think at uni, like what we said, you come out and you say, all right, I'm in private practice, but you can just make it whatever you want it to be. And I'm not trying to, I don't even want to say I'm not trying to show off, but pretty much the way that I've taken like my career, I mean, I would have never dreamed of it, honestly. Like when you said about Sunrise, I was laughing. I was like, yeah, I mean, that couldn't believe that either. But I think you just take it wherever you want. And I think with social media, that tells you all that you need to know, because you can make it something way more than just treating patients one-on-one.
Yeah, agreed.
Just most people don't want to be business owners because it's hard and risky and it's challenging and all that kind of thing. So yes, I guess if you want to work for someone, potentially there is limited growth within that. But if you're a business owner, sky's the limit.
Love that.
You're a great representation of that, and created a great following and putting out a great message, and we've loved having you on. We're looking forward to this pod, so we really appreciate your time.
Thank you.
Yeah, thank you.
Speak to you again soon.
Yeah, absolutely.
Thank you so much. Bye.
Have a good one.